name is Paul Mills. I'm a professor of family medicine and public health at the University of California, San Diego, and also chief of the Division of Behavioral Medicine. And I also direct what's called the Center of Excellence for Research and Training in Integrative Health.
So, Dr. Mills, I've known you for a number of years here in San Diego, and I know you've been involved with a lot of research looking at cardiovascular health, behavioral health, and more recently you've been very involved and interested in toxin exposure and its impact on health in various ways. Could you tell us a little bit more about how you got involved in that arena?
Sure. And my interest, it was more of a personal interest because I have a lot of friends who were switching to an organic diet and speaking about things such as Roundup and glyphosate. And when I'm introduced to newer ideas, one of the first things I do, I want to learn about them. So I went to PubMed, PubMed.gov, which has 30-some million scientific papers, and I started doing reading. And one of the things that surprised me is that there were no epidemiologic studies on Roundup. And for we as human beings and what our exposure to these compounds over the years has influenced us, has it or not. And I was surprised because we've been exposed to these compounds for about 25 years now since the GM crops were introduced in the US. So we decided, let's do it. Let's put together a research study and come up with some data. So that was the beginning, yeah.
To give us a brief synopsis of some of the major findings you've had and how it impacts how you talk to other clinicians and clients and patients and other folks at UCSD. Can you give us a summary?
Sure. Two main studies we've done so far. The first one, getting back to these epidemiologic ideas, we just wanted to document how has our exposure changed over the last, say, 2 decades. And so to do that, we tapped into some existing long-term studies comparable to the Framingham study, for example, where there were existing samples. And we ran assays on all these samples, and we were able to show quite clearly the highly significant ramp up of our exposure to these compounds that reside in our body over this time period since these foods were introduced into the US. So that was the first one. In many ways it was an obvious finding, that's what we expected, but it wasn't in the literature, and if it's something isn't in the literature, it doesn't really exist and people don't act on it as the way we should. And while we were doing that study, I came across quite a number of articles. These are more the animal feeding studies showing that if the animals are routinely exposed to these compounds the way we are in our diet, then what happens is they generate lots of toxicity for the liver as well as the kidney. And a couple of these studies provided mechanisms to these to the toxicity and described the toxicities as being very similar to non-alcoholic fatty liver disease that we humans have here in the US. That's also been more of an epidemic over the years. So naturally that made me think, is this why we just finished a study showing our exposures increased, and here are the animal studies saying if you're exposed, this happens to the liver. Could this be the source of it? So that led us to conducting this next study, which I can tell you about.
Yeah, and please tell me a little more.
Okay. So this other study we did, we teamed up with a liver disease center at UC San Diego and studied very in-depthly around 100 patients who have various degrees of liver disease. And we were able to replicate in concept these animal studies, and we showed that those individuals who have more severe disease, they have had higher exposure to Roundup and glyphosate. And we conducted it in terms of documenting how much urinary excretion they have, which is an index of how much you've taken in, typically through your diet, or it also could be through the skin as well. If, say, the person was in the horticulture industry or a farmer, although we didn't study farmers. So. But that was the second study that linked, for we as humans, this toxin in the environment and liver disease. And we'd like to follow it up because if this is really the reason or one of the reasons why we have this epidemic in the US, we need to know that as far as public health and begin to make changes to ameliorate those effects.
Absolutely, very, very important work. Thanks again for doing the interview with us.
You're welcome. It's been a pleasure. Thank you.